Hey everyone, and welcome back to the KenkoVibe podcast. I'm Ethan Reed,
And I'm Grace Morgan.
and we are diving into a question that we've seen popping up more and more lately.
Yeah.
Can a 10SS unit really help with ED?
It's definitely intriguing.
Yeah, it sounds a little too good to be true, right?
It does.
So, for our listeners who maybe aren't familiar with 10SS units, can you break down what they are and what they're usually used for?
So a 10NS unit is a small device.
Okay.
It often runs on batteries, and it basically sends these mild electrical pulses through the skin
Okay.
to target your nerves.
Interesting.
And it's primarily been used for pain management, so things like chronic pain,
Oh, wow.
back pain, or even migraines.
Okay.
Yeah.
I've even seen athletes using them like after a tough workout or something.
Yeah.
It's considered pretty safe, right?
Yeah, it's generally safe for most people.
Okay.
The main side effect is sometimes a bit of skin irritation from the pads.
Okay.
But yeah, using it for ED,
Right.
that's where things get interesting.
Yeah, how so?
The research is still limited. You won't find like major health organizations
Oh.
like the NIH
Yeah.
giving it a full endorsement.
Not yet, at least.
Yeah, not yet.
So it's not exactly like mainstream medicine yet.
Right.
But there was this study in 2020 that kind of caught my eye.
Yeah.
It said that 10NS was more effective for ED than exercise.
It did.
That's a pretty bold claim.
It is.
How did they even, figure that out?
So in the study, they put the 10NS electrode around the penis,
Okay.
and the men who used it saw significant improvement
Oh, wow.
compared to the group who focused on exercise.
That's fascinating.
Yeah, so it suggested that maybe that
Yeah.
targeted nerve stimulation might have more of a direct role in erectile function
Oh, wow.
than we previously thought.
That's almost hard to believe.
Yeah,
But there's got to be a catch, right?
you're right.
These studies always have limitations.
Of course.
What were some of the limitations with this one?
So one thing is that the study didn't include men who had some common conditions that are related to ED,
Oh, okay.
like diabetes or high blood pressure.
Okay, so not the average person who might experience this.
Exactly. So it wasn't a perfect sample group.
I see.
And then also, the study was pretty short, so
Right.
we don't actually know if those improvements would even last.
Yeah, that makes sense.
And it's really important to remember that exercise has so many proven benefits,
Oh, absolutely.
especially for your heart,
Yeah.
which can then improve blood flow and can indirectly help with ED that is related to blood vessels.
So you're saying KenNS isn't replacing my gym membership just yet.
Not just yet.
But this whole thing raises another question.
Yeah,
Where do you even put the 10NS pads for ED?
right.
I've seen people debating this online.
It's the million-dollar question.
Is it?
And the research is still a little fuzzy.
Okay.
But there's another study from way back in 2008
Hi.
that offers some clues.
Oh, okay. I'm all ears.
Okay, so this study focused on stimulating the perineum,
The perineum?
the area between the anus and the scrotum.
Yeah.
And they used electrostimulation, which is similar to what a 10NS unit does.
Right.
And they found some pretty fascinating results.
Oh, wow. Like what?
So both healthy men and men who had what's called neurogenic ED.
Neurogenic ED.
Yeah, that's ED that's caused by nerve problems.
Okay.
They saw improvements after having their perineum stimulated.
Oh, wow. Okay.
And the men who had that neurogenic ED
Yeah.
actually had results that lasted even longer.
So is this specific placement the key?
Potentially.
Okay.
But we really do need more research.
Yeah, of
They're
course.
still figuring out how this all works.
Look, we have a few puzzle pieces,
Yeah,
but not the whole picture yet.
exactly.
Well, while we're on the topic of ED treatments, it's important to remember that there are some proven methods out there already.
Right.
We don't want to get too ahead of ourselves.
Absolutely.
What are some of the more well-established treatments?
So medication is often the first line of defense, specifically a type of medication called PDE5 inhibitors.
What are those?
So those are drugs like Viagra and Cialis.
Okay, yeah, I've heard of those.
Yeah,
And those work by increasing blood flow to the penis.
exactly.
Oh.
Helping to achieve and maintain an erection.
Those are pretty well known, even outside of medical circles.
Yeah.
But those don't address the psychological side of things.
Now you've right.
So what does?
That's where therapy comes in.
Okay.
It can be so helpful for dealing with anxiety, stress,
Yeah.
relationship problems, all these factors that can lead to ED.
Right. It's not just physical.
Yeah.
It's a mental and emotional thing too.
Exactly.
And what about lifestyle changes?
Oh, you hit the nail on the head.
Right.
Diet, exercise,
Yeah.
sleep, cutting back on things like tobacco and alcohol. They
Right.
all play a huge role in your overall health.
Of course.
And that includes sexual health.
So it's about a holistic approach to health,
Absolutely.
taking care of your mind and your body. Okay, so with all that said, should someone just like jump on this 10NS bandwagon for ED right now?
That's a good question.
What's the verdict?
So while the research is definitely intriguing,
Yeah.
I wouldn't say that 10NS should be your first choice of treatment.
Okay.
It's really important to prioritize those proven methods we talked about.
Right.
And medication, therapy, lifestyle changes.
Yeah.
And I think it's always best to talk to a healthcare professional
Of course.
to figure out the best way to treat your specific situation.
So the jury's still out on 10NS for ED.
Yeah.
There's potential,
Yeah.
but we need more research
Yeah, we do.
to figure out where it fits in with all the other treatment options.
Exactly. We've uncovered some pretty cool stuff,
We have
but there's still so much more to learn.
always more to learn.
You know, it's interesting how this whole 10NS unit for ED thing has really captured people's attention.
Right.
Like, what do you think is driving all this curiosity?
I think part of it is just how accessible they are. 10S units are pretty affordable.
Yeah.
You don't need a prescription to get one.
Right.
You can order them online.
Yeah.
You can find them in like drugstores.
Mm-hmm.
It's way less intimidating than like going to the doctor
Right.
or thinking about taking medication.
That's a really good point.
It just feels like an easier way to start exploring options.
Right. It definitely lowers the barrier,
Yeah.
especially for guys who maybe are embarrassed
Yeah.
or feel some stigma around ED, so they might not want to go other routes because of that.
And there's something appealing about the fact that it's not invasive.
Yeah.
Like 10NS therapy it's not medication.
Right.
It's not surgery.
Yeah.
It feels more natural to a lot of people.
I think it taps into this desire
Yeah.
for drug-free alternatives.
That's a good point.
Which is becoming more and more popular in healthcare these days.
Yeah, like people want more natural solutions.
Exactly.
And don't forget the control aspect. With a 10NS unit, you can adjust the intensity.
Mm-hmm.
You can decide how long you use it for.
You can kind of find what feels good for you.
Right. Exactly. It's empowering.
Yeah.
Especially when you're dealing with something so personal.
Absolutely.
Like your sexual health.
It's about having agency.
Exactly.
But we do have to be careful not to oversell it.
Oh, yeah, for sure.
It's not a miracle cure.
Right.
People need to have realistic expectations.
Absolutely. It's not going to solve everything.
Right.
And it's definitely not a substitute for proven treatments.
Exactly.
And seeing a healthcare professional.
Always a good idea.
Now, speaking of using it responsibly, let's talk about safety.
Okay.
10NS units are generally safe.
Yeah, if you use them correctly.
What are some key things to keep in mind?
So first and foremost,
Okay.
read the instructions.
Right.
Every 10S unit might have slightly different guidelines
Okay.
about where to put the pads,
Yeah.
the intensity levels,
Yeah.
how long you should use it for.
Yeah. So not a one-size-fits-all situation.
Not at all.
Gotcha.
And I would say start low and slow.
Okay.
Start with a lower intensity setting and then gradually increase it
Okay.
until you find something that feels comfortable.
Right.
That way you can avoid any pain
Yeah.
and skin irritation.
And speaking of skin irritation,
Yeah.
what about those electrode pads?
So make sure your skin is clean and dry
Okay.
before you put those pads on.
Yeah.
And if you notice any redness or itching
Okay.
or any burning sensation,
Yeah.
you should stop using it
Makes sense.
and talk to your doctor.
So basically common sense and listen to your body.
Exactly.
Are there any medical conditions where using a 10NS unit might not be a good idea?
Yeah, there are definitely some situations where you should avoid it.
Like what?
So if you have a pacemaker or one of those implanted defibrillators, you don't want to use a 10NS unit.
Why not?
The electrical pulses could mess with those devices.
That makes sense.
And I'm guessing you're about to ask about pregnant women.
I was going to say, should pregnant women avoid them too?
It's best to err on the side of caution.
Yeah.
We don't really know how 10NS affects fetal development.
Okay, so yeah, not worth the risk.
Not worth the risk.
So being informed and making smart choices is really important.
Absolutely.
But even with all the precautions, there's still so much we don't know about 10NS and its long-term effects.
Exactly. Like, do the effects even last?
Yeah.
That's a big question.
Right. Are the improvements just temporary?
Right.
Or do they stick around?
Exactly. And we still don't know for sure where to put those electrodes for the best results.
Right.
We talked about the perineum.
Yeah.
But maybe there are other areas that work even better.
Could be.
Definitely a lot more research to be done.
It's a wide open field.
It is.
So as we learn more,
Yeah.
our understanding of 10NS and how it affects men's health is going to keep changing.
For sure. It's exciting.
It is.
It's like we're on the cusp of something new.
So what's the biggest takeaway for our listeners?
I'd say 10NS units for ED show promise,
Yeah.
but it's not a quick fix.
Okay.
And it's not going to replace those treatments that we already know work. It's just a tool.
Another tool in the toolbox.
Exactly.
But you got to use it responsibly.
Responsibly.
Have realistic expectations.
Realistic.
And talk to your doctor.
Talk to your doctor.
Now, there's a question that keeps coming up
Yeah.
in the comments.
Okay.
A lot of people are asking if it's safe to use a 10NS unit
Yeah.
while also doing other ED treatments.
No, like medication or therapy.
Right, exactly.
That's a great question.
What are your thoughts on that?
Honestly, there just isn't enough research yet
Okay.
to give a definitive answer.
So we're in uncharted territory.
A little bit, yeah.
And in those situations, it's always best to be cautious.
Always
Talk to your doctor
talk to your doctor.
before mixing and matching treatments.
It-
It's all about having that open conversation with your healthcare provider
Yeah,
to figure out what's best for you.
absolutely. We've covered a lot
We have
about 10NS units for
the
ED.
benefits, the risks, the
The
unknowns.
whole shebang.
And we've really emphasized
Yeah.
making informed decisions,
Right.
being responsible,
Responsible.
and talking to your doctor.
Always talk to your doctor.
Get ready for the final part of our deep dive.
Okay.
We're going to wrap up our discussion and leave you with some food for thought.
I like it.
Welcome back to the KenkoVibe podcast.
We're back.
We've been talking all about 10NS units for ED.
Yeah, it's been a fascinating conversation.
As we wrap up this deep dive,
Yeah.
what are some key takeaways for our listeners?
Well, I think the most important thing to remember
Yeah,
is that ED is complex.
it is.
There are a lot of different reasons why it happens.
Right. It's not a one-size-fits-all thing.
Exactly.
That's why it's so crucial to see a doctor. They can help you figure out what's causing your ED
Absolutely.
and recommend the best treatments.
Right. And those treatments might not include a 10NS unit.
Right. Because even though the research is promising,
Yeah.
it's still early days.
Exactly.
We need more research to really say for sure
We do.
if it's effective.
Yeah. And if those effects are lasting
Yeah.
long term.
But for those guys who are curious about 10NS therapy,
Yeah.
approach it with caution.
Definitely.
Be realistic.
Have realistic expectations.
It's not a quick fix.
It's not a magic bullet.
And it's not a replacement for the other treatments out there.
Right. Like medication,
Yeah.
therapy, lifestyle changes.
Exactly.
Those things are still super important.
And of course, use the 10NS unit safely.
Yes, always.
Read those instructions.
Read the instructions.
Start on a low setting.
Low and slow.
Listen to your body.
And if something doesn't feel right,
Yeah.
stop using it and call your doctor.
You know, it's easy to forget,
Yeah.
but ED can be a sign of other health issues.
Like heart problems,
Yeah.
diabetes, hormone stuff.
Yeah, that.
So it's about looking at the bigger picture
Right.
and taking care of your whole self.
Your mind and body.
Exactly.
Yeah.
They're connected.
As we finish up this deep dive,
Okay.
I want to leave our listeners with something to think about.
I like it.
With all this interest in alternative therapies for ED,
Yeah.
what role do you think technology is going to play
Mm-hmm.
in the future of men's sexual health?
Oh, that's a great question. It is. It's exciting to think about all the possibilities.
Yeah.
Will we see new devices, new treatments?
Right.
Who knows?
It's definitely something to keep an eye on.
Absolutely.
That's all the time we have for today's show.
Oh.
We hope this deep dive into 10NS units for ED was helpful.
We covered a lot,
Remember, knowledge is power.
especially when it comes to your health.
Stay curious.
Yes.
Do your research.
Always.
And talk to your doctor.
The Holy Trinity.
If you like this episode about 10NS units for ED,
Yeah. Make sure you subscribe to the KenkoVibe podcast
we've got more deep dives coming your way.
on all things health and wellness.
All the things.
And if you found this episode useful,
Yeah.
hit that like button,
Leave us a comment.
share it with your friends.
Breath of love.
Thanks for joining us.
See ya next time.
This is Ethan Reed.
And Grace Morgan.
Signing off,
Stay curious.
and keep those vibes high.